Yeah. So basically, cytoreductive surgeries and HIPEC is a relatively new concept. Initially, peritoneal cancers is not, it's an upcoming field. Basically, these include primary cancers which arise from something called a peritoneum, which is the lining of our abdominal cavity from the inside. So they
Okay.
can be primary peritoneal carcinomas or they can be mesotheliomas. They are relatively rare cancers.
Okay.
And more common is what we call as metastasis of other cancers to the peritoneum, which
Right.
is much more common, which you see in commonly found cancers like ovary,
Okay.
stomach, colon, and appendix.
All right. Yes.
So traditionally, this advanced cancers were used to be considered very advanced, and
Correct.
since the routine chemotherapies and routine surgeries failed, they were usually left untreated, or the patients were just given what is called as palliative chemotherapy. And
Correct.
after that, the patient didn't recover. The usual lifespan used to be 3 months to 6 months. So now, with advent in this techniques of cytoreductive surgery, improvements in perioperative care and ICU care, uh, improvements in intraoperative patient monitoring, and use of this technology called as HIPEC, which is heated intraperitoneal chemotherapy, wherein after the surgery, a hot water bath is created inside the abdomen itself,
Oh,
wherein a heated chemotherapy heated up to 42 degrees Celsius is circulated using a special machine called as a
right.
HIPEC machine, and it can be circulated anywhere from 30 to 90 minutes.
Correct.
And after that, the chemotherapy drug is removed and the abdomen is closed.
All
So
right.
for certain cancers like pseudomyxoma, where no other treatment exists, if it's a low-grade pseudomyxoma, after the complete surgery with HIPEC, patients are alive even 10 years after surgery, wherein initially they used to not live for more than 6 months to a year.
Oh, wow.
In
That's
cases
right.
like ovarian cancer, also nowadays we have recent data where if the even in advanced cases of ovarian cancer, if it is not amenable to upfront surgery,
Hmm.
you can give three cycles of chemotherapy, and after that you can do cytoreductive surgery and HIPEC, and it has a better survival benefit compared to only chemotherapy and surgery. There are some
Okay.
patients who receive only chemotherapy in ovary, which is absolutely wrong because they should receive chemotherapy as well as cytoreductive surgery. And now recent evidence shows that adding HIPEC to the cytoreductive surgery adds to the survival. So in
Benefits even more. Yeah.
yes, it benefits even more. And even in certain selected cases of the stomach cancer and colon cancer, which have spread to peritoneum, which technically makes it last stage, so that is the fourth stage.
Hmm.
But in selected cases, you can even use HIPEC in them.
Okay.
So, for primary peritoneal cancers, which I told you, the primary peritoneal carcinoma and mesothelioma, these are relatively rare cancers.
Right.
Maybe 1 in 1 million kind of a incidence rate is there. So even for these cases, routine chemotherapy doesn't work so well. So
Correct.
cytoreductive surgery and HIPEC is the mainstay for these cancers also.
Correct.
So for example, this, then I'll have to add one more entity to this. So that we also do a new technique called as PIPAC, which is aerosolized chemotherapy. So for example, in stomach cancer, when it's spreads to the peritoneum, it is stage 4. With in that usually surgery is not done, and we give only traditional IV chemotherapy.
Okay.
So in that, even with chemotherapy, the maximum survival rarely touches 6 months to 1 year. So
Hmm.
what we have seen that in stomach cancers who are not responding to routine chemo or even upfront,
Hmm.
we give a combination of what is called as a bidirectional therapy. So that means we give intravenous like a traditional chemotherapy, and at the same time we add something called as an intraperitoneal chemotherapy. That means the chemotherapy directly inside the abdominal cavity.
Okay.
So that can either be given as a liquid form, where we put in a port in the tummy and inject the chemotherapy every week from there, along with the standard IV chemotherapy. Or
Okay.
the other option is we give something called as PIPAC, which is aerosolized chemotherapy. So it's
All
like
right.
surgery wherein the patient is admitted for 1 day, we do the PIPAC, and next day the patient goes home.
Hmm.
And so this PIPAC is done every 2 monthly, and in the interim 2 months, the routine IV chemotherapy is done.
Okay.
So in some patients, we have seen that the response is so fantastic
Wow.
that the
Hmm.
peritoneal disease regresses to more than 50% reduction in disease is seen. Sometimes even 80% reduction in disease is seen. In such cases, a potentially patient who can't be operated, we can then actually take this patient up for surgery. We can do a CRS, that is cytoreductive surgery, and a HIPEC surgery in them. And a potentially terminal patient, we are technically curing it. We may be able to cure it for just a year or two more, but where the patient is going to die in 6 months, we are extending his life by 3 to 4 years at least. So we are getting
Correct.
around a few years extra and with a good quality of life.
All right. All
That's
right.
recommended by selected cases. You can't do it in each and every case of fourth stage cancer. Only in certain cancers which are responding to the therapy, we can really provide a lot of newer technologies and we can extend the survival and without compromising the quality of life. That is also important.